Every who down in Who Newville liked the holidays a ton, but where to get great prices on gifts, they had no idea. None. They searched and they searched for great gifts under $25. Gifts for spouses and friends and even their toddlers. When suddenly one who shouted, Walmart has what you want, knowing they have Lego, Tree Hut, and low prices to flaunt. So they enjoy the holiday season as who's often do. Cheering and shouting, Walmart has incredible gifts. Who knew? Find gifts they'll love under $25 at Walmart.
This episode is brought to you by LinkedIn. Psst, healthcare pros, word's out, and it's too good to keep quiet. Look, LinkedIn is revolutionizing job hunting, making it possible to search by specialty, shift preference, and salary. Endless scrolling is out. Whether it's a mental health therapist or dental hygienist, finding the perfect role is faster and easier than ever. Head to linkedin.com/healthcare and start your search today.
Welcome to the Dr. Raj podcast with Dr. Raj Dasgupta, a show all about educating patients, students, and aspiring doctors about better patient care. Dr. Raj is a quadruple board-certified physician and associate professor at the University of Southern California. He was a co-host of the TNT series Chasing the Cure with Ann Curry, as well as a regular on the TV show The Doctors. And now, here's our show.
So let's keep on talking about the ICU stuff. One of the favorite things that they ask on board exams, and I'm sure even the general public here heard this word before, anaphylaxis.
Yes.
And I think that's where me and you kind of team up together.
Yes.
Definitely a form of distributive shock that you don't want. And really some horrible things can happen there. So in general, how does people know, how does anaphylaxis present?
Okay.
You know what I mean?
So anaphylaxis actually has 3 definitions.
Oh, okay.
So one is like Dr. Raj was talking about, right? You take a medicine and your blood pressure starts to fall. Then most people by that point start feeling lightheaded. They know something's amiss, right?
Yep.
And that's anaphylaxis, right? Being hypotensive. The other one is if your throat is closing, what we call laryngeal edema, that's anaphylaxis. Fun fact number 3 is if you have 2 symptom involvement. So let's say you took amoxicillin and you all of a sudden now have wheezing and hives. That's anaphylaxis.
Oh, I did not know that.
Yes.
Now, I always thought that the most common organ involved with anaphylaxis was skin. Is that still correct?
Correct.
Can I do skin and wheezing?
Yes.
Anaphylaxis?
Correct.
Wow. All right. I like that.
Yes.
I did not know that. Let's say we'll make it for the general public right now, and they have, wheezing and skin reaction, or God forbid, their blood pressure drop. I don't know how they'll know that, but what should they do?
You call 911.
Well said.
You call 911. Most people, I would say first line is always treating yourself with an EpiPen, right? But not everyone has an EpiPen at home. So if you're feeling it, right, you just call 911.
Let me ask you, you may not know the answer to this, so I feel bad asking.
Yeah, ask
so
me.
How many people, because I'm sure the first presentation for anaphylaxis is, it just presents, you're not expecting it, it just happens. Do most people pass away from their first episode of anaphylaxis? They don't make it to the ER?
Actually, no. I don't know the statistic off the top of my head, but most people do not.
That's good.
That's very good, right?
Yes.
Most people are generally, more often than not, your initial reaction will not be an anaphylactic episode to something. Right?
Yeah.
And it's dose dependent in how much you take, right? So I would say most people, amazingly, even when they have an anaphylactic episode, are very on top of getting to the ER.
Okay.
And they get there.
Because I think the stories I hear a lot of, there are people who are diagnosed with anaphylaxis and they carry the EpiPen.
Right.
And I can't say enough that one of my pearls or my teaching to my fellows, if someone with anaphylaxis even has the tiny symptom, inject.
Yes.
So that's what I'm wondering.
Yes.
Does most people die because
most people, because it takes, when your body starts reacting, it takes a while, right?
Yeah.
I'm just going to start with the hives, right?
Yeah.
When you first get hives and you feel short of breath, you have a little bit of time. The problem is if people choose to ignore those symptoms and go to sleep and then wake up to see if it's there in the morning.
Oh my God. Yeah. I'm sure there are people like that.
There are people like that.
So let's talk about two less common drug allergies. You know what I mean? And I wrote that in my notes, and I put, this is for my medical students and healthcare professionals,
Yes.
you know? So there's something called serum sickness.
Yes.
Let's talk about that first. So I don't want to mix it in. What is serum sickness? And you got to make it simple for us too, okay?
So serum sickness is when the body sees, let's say, a medication we'll use, and it starts making, like, antibodies start clumping, right? And then you can have different manifestations to it, whether it's skin rash, which is actually a fun fact, like a purple colored rash sometimes. You can have liver involvement, kidney involvement. Luckily, we don't get a lot of serum sickness as much. What we actually get is something called serum sickness-like reaction. Serum sickness-like reaction, we actually don't know the official pathophysiology for. It's a little tricky. I actually had someone, it was like my first month at Keck, she came in to me and she actually received a vaccine, so it's not quite a drug. And she was like, I don't know, I keep getting hives that don't go away. I got this vaccine and they keep putting me on prednisone, and I finally decided I should come see you. And she saw me. She was having a serum sickness-like reaction.
So let me take a step back, because now I'm getting a little lost. So can anything cause serum sickness? Or there's certain triggers?
There's certain things that specifically cause it. Serum sickness specifically can be vaccines, can be drugs. Kids are notorious for getting serum sickness due to drugs.
So anything can cause it.
Technically can.
But it's not a common manifestation.
It's not a common manifestation. It's more of the rare manifestation.
But your buzzwords as an allergist are vaccines.
I would say vaccine and drug, right?
Vaccine and drug.
Kind of think about it if someone comes in for serum sickness, because we have the immunoglobulins clumping in places.
Hence the word serum.
Hence the word serum.
Okay.
And if you catch it immediately, technically another immune cell called the complement should be low.
Okay.
People can have manifestations within like their kidneys. So sometimes you see something if you do a urine test.
Yeah.
Right. But I would say we always check the blood counts. We check urine. We check complements. Right.
So what's the diagnostic criteria if you want to diagnose it?
It's not a specific diagnostic.
So it's hard to diagnose it.
You go based on the time frame and the reaction, right? If someone has a rash and they're telling you like I did, back in the day, they used to give horse serum.
I don't think we should do that anymore. It just sounds wrong.
We don't do it. But for like treating people like anti-venoms and horse, and you would react to those. So serum sickness used to be a lot more prominent. We don't get it as much now. We get much more serum sickness-like reactions because
is it supportive care?
It is supportive care.
Okay.
Like all things, right? It depends on the severity, right? If someone's having a little bit of a mild reaction, let's say their skin is involved, right? You can give antihistamines. If it's really severe, you can give steroids, right?
Okay.
Obviously, the treatment for that is never, ever take that agent again.
Yeah.
Right? If you have a serum sickness-like reaction or serum sickness.
No, so I feel good because it's one of those things where we know the words as doctors and medical students and residents, but I don't think I could spot it out because it doesn't have a classic,
right?
You know?
I think you'd be okay at it. Like it's not.
You are the nicest.
No. But I think most people, it's not one of those like. I think the harder ones are like, let's say someone takes something and they're mildly itchy, right?
Yeah.
Those are the harder things because people are always like, was it, wasn't?
Okay.
If things are clumping within your body and your organs.
So you get target organ damage.
You can get target organ damage. The skin's involved. Kidneys can be involved.
So it's clumping in the blood flow going to the kidneys.
Kind of. It's IgG.
Okay.
Technically, your immunoglobulin goes in clumps and it can go and hide in the kidneys. And hide in different places. So people, it's not very like obscure, like itching, was it, wasn't it?
Now, what about this one? It's called DRESS.
Right. That's the one we alluded to earlier.
And we love, we do love acronyms.
Yes.
You know what I mean? So DRESS stands for drug rash with eosinophilia and systemic symptoms.
Yes.
Well, I mean, how do you break that down? And can anyone get DRESS? And what are the triggers? You know what I mean?
Technically, we have specific alleles that they're narrowing down, which are specific things on our genes that make some people more predisposed, right? Vanderbilt's actually did a lot of studies on that, and they narrowed it down for certain things, certain medicines before your doctor gives it for the alleles they know they check for, right?
Okay.
Anticonvulsants, a lot of times they check for those alleles in specific people before they
like a phenytoin, valproic
right.
acid, Keprel, those kind of things. Okay.
We don't have it for every medicine. Though. So usually this reaction is one that you'll take the medicine and it happens around 2 weeks later.
Okay, so there's a time frame
there's
involved.
a time frame.
Okay.
So you'll take the medicine. 2 weeks later, you'll start getting drug fever.
Okay.
Right? Rash. If they do blood counts on you, you have eosinophils.
A specific type of white blood cell gets up there. Okay.
There. You'll have end organ damage. What does that mean? Liver numbers can go up, kidney numbers can go up, right?
Okay.
And they're seeing that these reactions done by our T cells are kind of infiltrating the body more.
So these two things, I don't want to lose anyone. So serum sickness, DRESS, anyone can get it.
Right.
You know what I mean? That's the thing from any drug we talk about, but they're not the most common things.
Correct.
And most of the things going way back to the beginning, because I was paying attention to everything, is adverse reactions to drugs.
Adverse.
Make sure it's an allergy.
Right.
And if it's an allergy, you know what I mean? Thank God not many people go all the way to anaphylaxis.
Correct.
And rule number one, no matter what it is, if you think you're allergic, stop the drug.
Yes.
Oh man, this is great. So, okay, back to questions that were sent to me for you. Okay, this is from all my listeners. All right. If I'm allergic to they loves it. If I'm allergic to one beta-lactam, such as penicillin, the beta-lactam drugs, should I avoid them all?
Yes, until you can be evaluated, because we can definitively check, but without knowing the person's prior history to the medicine, right? Let's say you took one and you had DRESS.
Okay.
Without knowing, we can't definitively say yay or nay. Right?
So let's go back to me in my clinic. So everyone nowadays is augmented. I think my little girl got augmented because I see she had a little otitis media, So let's say, a couple weeks later, she had a reaction to Augmentin, whatever it is, nothing too bad. Should I give her the Keflex a week later, or should I send her to you first to make sure?
I would say always come to allergy and be cleared.
Okay.
Right? We have ways we can clear you. We do skin testing depending on what it is, the graded challenge. Because I'll tell you the hard part. Let's say you take something, and this happens to me more often than not. Yeah. Someone takes something at home and they're like, I took it and then I was itchy. I wasn't there to see the itching. Was it within the time frame? Was it not? Because I'll have to check you anyway.
Yeah.
Right? So then that way we definitively clear you in the office, and then I can be like, yes, you can take it.
I like that. And now, do you think most people take it seriously? That they didn't know you're available? That's what allergists do when it comes to these things?
This is what most allergists do. Well, most academic allergists for sure will do it. I definitively do it. Sometimes an outpatient penicillin is easy to obtain, but some of the other medications may take a little bit more work. But allergists definitely can do this.
Now, how about this one? So aspirin, new guidelines, broad strokes, not everyone needs to be on aspirin, which I totally agree on. So question is, I'm allergic to aspirin. Should I avoid all what they call non-steroidals? And so I guess that's ibuprofen, the Advils and Naprosins, or something called a COX-2. And for the general public, COX-2 inhibitors are kind of like non-steroidals, but they don't damage and give you ulcers in your stomach as much. So how would you address that?
Technically, anyone who is allergic to a COX-1 inhibitor, i.e., let's say aspirin and its relatives, should be able to tolerate a COX-2 inhibitor like Celebrex. Saying that, though, I always tell people, if you have a doubt, let's say, and you don't know, come in for a graded challenge. It's a 2-hour fast way to know. So aspirin allergy, they want to take ibuprofen. Would you risk it or say come see you first? I would say come see me first. I've had patients who, and I'll tell you why. I've had patients who can be, let's say, ibuprofen. Yeah. You can technically be allergic to ibuprofen and tolerate other NSAIDs. You can be allergic to a single NSAID, or you could be allergic to the whole class. Interesting. And without officially checking someone, you don't know. Okay. No, I like playing it safe. And I wonder where this came from. Have you heard of a steroid allergy? Yes. Oh my goodness. Absolutely. Yes. Are you sure? Yes. I think my patients are making it out when they say that. No, they are right. You can. Okay. So you can. So fun fact about steroids, for the type 1 reactions we talked about, they don't all cross-react with each other. So if someone comes in and they tell me they're allergic to one, we do skin testing, we do deeper skin tests, and we find alternative agents. I've actually had two patients within the last month come in for steroid allergies. Really? Were they real allergies? And what was it? What was the reaction? One of them, actually, both of them were real allergies, and we found alternatives. One of them was rash, and the other one was hives. And for those who don't understand why I find this interesting, I kind of chuckle a little bit.
steroids are kind of like we use when you have bad
treat,
allergic
right.
reactions.
Unless you're giving someone what they're allergic to.
Yeah,
Right?
which is weird.
And then another fun fact, you can have like a rash to steroids as a type 4 reaction. And they don't all cross-react with each other.
And I know the answer, but I want to hear it from you. And not all steroids are made equally.
Correct.
So a dexamethasone, a prednisone, a solumedrol, it's not weird to be allergic to hydrocortisone, but not solumedrol?
Right, because the body becomes allergic to what it saw. So let's say your doctor keeps giving you prednisone, and you never got dexamethasone. How are you going to become allergic to
Let me put you on the spot.
Ask me.
I'm allergic, I'm not, to a steroid.
Okay.
What do you treat me with besides stopping it?
Well, let's say you immediately need something, right?
I immediately need something.
We desensitize you.
Okay, so you put me in a hospital setting.
We put you in a hospital and we give you little doses of whatever. Let's say you, I don't know, we'll make something up, but let's say you have a rash and you need 40 of prednisone.
Okay.
Then we desensitize you to 40 of prednisone.
Simple stuff. But have you seen anyone get anaphylaxis from a steroid?
It can happen, but I haven't seen it yet.
I haven't. I'm
now
just like,
that I've said it, it'll probably happen, but I haven't seen it yet.
No, you're getting me excited about these questions. Good job, listeners.
When the holidays start to feel a bit repetitive, reach for a Sprite Winter Spiced Cranberry and put your twist on tradition. A bold cranberry and winter spice flavor fusion, Sprite Winter Spiced Cranberry is a refreshing way to shake things up this sipping season. And only for a limited time. Sprite. Obey your thirst.
Did you know you can opt out of winter? With Vrbo, save up to $1,500 for booking a month-long stay. With thousands of sunny homes, why subject yourself to the cold? Just filter your search by monthly stays and save up to $1,500. Book now at Vrbo.com.
Okay, you kind of mentioned this already. So someone just wants to mention about sulfa drugs. Are they like super high on the common list for drug reactions and allergies and all that kind of stuff?
A little bit more notorious for T-cell reactions, but newer data shows that you can actually, if let's say you had hives to sulfa, just like penicillin, you can lose your sulfa allergy with time. We skin test to it.
And you said that happens with penicillin too, right? You lose that, right? I guess for like my docs out there and healthcare, providers, I always get a little weird about giving Bactrim, you know what I mean, for UTIs. I'm like, well, I want to get a sulfa allergy for it. You know what I mean?
So. I think, right. I think all of us, I've had patients who've had Stevens-Johnson syndrome, sulfur, right?
Yeah.
I used to work with a cardiologist when I was an intern who had 2 patients have really severe reactions from sulfa. So he never prescribed them, right?
Yeah.
So I hate to say it, but I think as physicians, whether we want to be or not, we're a little biased based on what reactions we've seen, right? But most people don't have such severe reactions. Right?
What's more common, a penicillin reaction or a sulfa?
I think it depends. More people will have T-cell reactions to sulfa than to penicillin.
Okay.
But people prescribe penicillin more frequently, right?
Look at you with the nice response. Okay, so it's hard to say apples for apples because penicillin is so
it's
common.
So common, and people feel so comfortable prescribing it.
So anyway, I'm going to be self-serving once again. So I do sleep medicine. I don't know if you knew that.
I know, that's so cool.
Oh, thanks, man. So one of the drugs I use for narcolepsy and these hypersomnias is modafinil.
Okay.
Provigil. There's a little sulfa in there. So have you ever seen any patients who reacted to modafinil or modafinil?
Okay. I don't think it's impossible either. Sometimes they forget.
That's good.
Right? But none that have actually
good. Because I give it like candy. You know what I mean? So I'm happy.
And just as a fun fact, although everyone should be checked, not all sulfuras are created equally.
Okay.
If you're allergic to a sulfa antibiotic, it's different than a non-antibiotic. Right? So a common question we get a lot is someone has a Bactrim allergy. Can they take Lasix?
And the answer is?
The answer is yes.
So you kind of read my mind because I remember in med school, there was a loop diuretic that no one ever uses.
Yes,
called
ethacrynic acid.
Yes. In theory, if you got to give a loop diuretic and they're sulfa allergic, if ethacrynic acid. Yes. Have you ever seen someone get a sulfa allergy reaction to Lasix, furosemide?
I've had patients actually react to Lasix itself, and I've had to give ethacrynic acid.
Really?
Fun fact. But then they were able to tolerate their Bactrim, right? Because they were reacting to the Lasix.
Oh, I love that. I love that. One of my listeners wants to know about, they have an egg allergy. Should be worried about vaccines?
It depends on what vaccine specifically, right? So different vaccines have different components of egg in them.
Do they all have egg?
Not all of them. No, we have like lists. Like yellow fever has egg, and
Okay.
MMR may have a little.
Do you have to memorize that for your boards?
We did. We had to actually memorize it for the allergy boards.
Doesn't the flu shot have egg in it?
Yes, but it's so negligible. We don't actually even, if someone's even egg anaphylactic.
Because I think they put this questionnaire because it's wintertime and flu shots and all that stuff.
It's not contraindicated. We actually had an allergy practice parameter. Oh my God, I think when I was a fellow that came out, that's like, give the vaccine. If they're egg allergic, you don't have to hold the flu shot. Depending on the reaction, you can monitor for up to 30 minutes. What I do is it depends, one, on the reaction and two, on the parent, right?
Yeah.
Especially because if their kids are little and they're really scared, I say just hang out in my office for 30 minutes, right?
So let's make it just like the reality. So there's everyone should still get their flu shot right now.
Yes,
Still get their flu shot. And let's say they're filling out the form they hand you and it says, oh, you may have an egg allergy. Would you say in that case, just get the flu shot and maybe just hang around a little bit longer?
Around a little bit.
Okay.
Technically, the only one we recommend that you get skin tested for based on egg allergy is yellow fever. And that's for most people that are like traveling. We don't normally give yellow fever vaccines.
Yeah. And you know what, man? And once again, travel medicine.
Yes.
It goes under the radar here in the United States.
Yes.
We do worry about what we're going through now, but dengue fever, yellow fever, malaria.
Yes.
Oh my God. Now let me put you on the spot.
Yes.
Did you know there's a malaria vaccine?
Yes, I only found out because I had a patient who inadvertently thought I was travel medicine at Keck and came to me to receive like this plethora of vaccines.
Oh, really?
And I was like, I'm not travel medicine, but since you're here, let me answer any questions you had.
Sure, yeah.
So we went through the different vaccines, and then later that, I think, week they made a appointment with travel medicine and they got their pokes.
And this malaria vaccine is not available in the United States. And it's only to falciparum.
Yes.
But it's amazing. We're so caught up in being the United States. This is huge.
Yes.
So when you mentioned yellow fever, I just kind of got me on my little pedestal right there about talking about it. Now, what about ACE inhibitors? For those who don't know what an ACE inhibitor is, those are drugs that we use for heart failure and blood pressure. Drugs like lisinopril or captopril or ramipril. They causing cough and swelling of the lips. Are this common, not common?
Cough is very common. Yeah. It's an adverse effect of an ACE
inhibitor. All right. Yes. Okay.
If you have cough, you can obviously stop it depending on how bothersome the cough is. So fun fact, my father was on an ACE inhibitor and had cough to it. And the cough was so bothersome for him, he stopped it. He's on an ARB now.
Okay.
He's doing fine. But for anyone who has angioedema to an ACE inhibitor, that is an absolute contraindication. You should never be on an ACE inhibitor again.
Tell the public what's angioedema.
Angioedema is that swelling we talked about, right? Mm-hmm. So let's say your lip is swollen, your eye is swollen, your ear is swollen, your hand is swollen, hard swelling. It's not a soft swelling. Usually it's a hard swelling. Your throat is swelling. Never, ever, ever, ever. If you have a question of whether something is swelling, take a picture. I always say pictures are worth 1,000 words. Stop the medicine and then see.
And you know what people should do? If you Google just angioedema, it's scary.
It is scary. And it's not always that severe, right? I've had people come in with like one eye will be swollen from angioedema, right? And then I'm like, let me know, because I've had people confuse different kinds of swelling. But if you show me, then I can definitively tell you, right? The internet shows the super scary, most severe. Of course. You can have more mild forms, but even if it's mild, you should still stop the medicine.
Oh, 100%. And, and the take-home message, because we, meaning me and you, there are different types of angioedema, and I think the most common is the allergic one, right? But once in a while, like the ACE inhibitor one or a family type, all that stuff we talked about earlier, some histamine, some steroids, they don't do nothing for those.
Correct. For individuals who specifically have either the ACE inhibitor or the familial kinds, we call it hereditary angioedema. We have type 1, 2, 3, depending on the protein that's low, the C1 esterase. It's either protein function or autosomal dominant genetic. On the third one, we have a family history for. We actually have specific medicines that treat the components that are low.
That's scary, because if someone has it, God forbid.
Yes.
Tell me if I'm wrong, but if they just get swelling or flare or swelling of the tongue on an airplane and they don't have their stuff on them, that could be life-threatening, right?
Correct.
Because you could EpiPen and steroid all you want.
Right.
So it's, oh my God. You know what I mean? So the take-home message for the people, And 0.0, you might not even know what you have.
Right. So
Okay.
always one. So for instance, if someone comes in and they're just telling me they have angioedema,
Yep.
we take a history. Do you respond? Do you not respond? And we still actually check them for hereditary causes.
Okay.
I had one patient, this is super rare. I don't even know how often this happens, had both.
Oh.
And I
Oh
was
my
like,
God.
oh
It's
my
so
God.
confusing.
So
they double inject.
So, well, we had to treat for the hereditary
Okay,
part
yeah.
and remove their allergic
Yeah.
trigger, but otherwise you never know.
Is that your jam? Do you take care of hereditary angioedema?
We do take care of hereditary angioedema.
Okay, now, there's
Yes.
not many doctors that do that,
Yeah,
so I
actually,
will remember you for that.
Remember me.
Yeah.
When where I trained, one of my mentors is really big in the hereditary angioedema world, so we saw a lot of them.
That is awesome. Oh, on side note, just true story. So my wife, Michelle, she's amazing, rheumatologist, and she loves marathon running. That's her jam, you know. I'll never forget this. It was around maybe like 7-8 years ago. She was running here in LA. You know, she's from the East Coast, but we moved here together to be in LA. And she got diagnosed with exercise-induced angioedema. I never thought if you ever heard of that before.
Yes.
Yeah, she was running, and then she had trouble hearing, and her ear canals got swollen. Yeah, so it's crazy. There's even subtypes.
So we'll talk a little bit about this has nothing to do with the drugs, but we'll go through cofactors that make like anaphylaxis worse.
Just do it.
Ibuprofen, Motrin, aspirin, Excedrin, NSAIDs.
Okay.
Exercise, alcohol. So a lot of times if someone is having an allergic reaction, they'll take like ibuprofen or something and it can make it worse. You were specifically talking about exercise-induced anaphylaxis. We have a subset of that called food-dependent exercise-induced anaphylaxis.
Really?
Which is a super fun fact. That they normally can tolerate the food, but if they eat the food and then exercise, they will react to that food.
Oh my God.
Yes.
And this is why we need you.
Thank
you.
You
know what I mean? Thank God these are not the most common, you know?
Fun things for people to be aware of, right?
So, there are non-allergic drug reactions.
Right.
So, I mean, we're only talking about allergic drug reactions. Right. What is a non-allergic drug reaction? And what drugs cause a non-allergic drug reaction?
I think it depends, right? So, like, we break allergic drug reactions into, like, the IgE type, like the type 4. Mm-hmm. So anything to me, I would say that has some kind of immune system would be allergic. But I think most people break allergic and non as like IgE versus non.
Okay, right? And IgE being the big culprit.
Okay. And then let's say you take a medicine and you get a rash. I think some people just take it as a non-allergic, right?
And is there some specific drugs that like to go down that pathway a little bit more of the non-allergic ones?
Non-allergic, like the non. So
if you had to memorize some stuff for the USMLE, United States Medical Licensing.
Yeah. The like phenytoin.
Okay.
I would say allopurinol can do it. Sulfa, right, causing those kind of reactions.
And how would you know as a clinician that it's non-allergic? Would you have to check an IgE to that drug?
The reaction. So if someone comes in and they're like, 7 days later, I broke into a rash that was itchy. To me, that's a non-IgE mediated because IgE happens somewhere between usually 2, but up to 6 hours later, right?
After the second exposure?
After the second exposure.
So I'm listening. I'm listening. So let's talk about some risk factors, okay? So I know you mentioned a bunch of these. Risk factors for getting a drug reaction are going to be watch what you take, the alcohol, exercise. Mm-hmm. Is there anything else like as far as is it good getting good family history? You know what I mean?
Family history lets you know it's not a one-to-one like, oh, drug allergies. I mean, the HLAs, the T-cell ones we talked about, okay, for sure.
But you check those things?
But no, I mean, some of them we do, but that's a whole, like, who you check it for. Okay. But family history, right? What you check for is someone who has more drug allergies is more likely, like the people that come in, and I'm sure you've seen them, have like 15 things written. Right?
Oh my God.
They're more likely to be allergic to more medicines, right?
Yeah.
If someone is taking medications for a chronic illness, obviously more courses predispose you to being exposed, and exposure will predispose you to becoming allergic.
Sure.
Right?
How about gender? How about BMI, or how about ethnicities? Any of those things play a role?
I would say specifically, not to get too into it, females are a little bit more predisposed.
Okay.
Right?
Just out of curiosity. Okay. And question, if you have a drug allergy, any useful tips, and this is going to be from a listener, to prevent complications in the future? And I guess to give an example, like, should I wear like a medical alert tag or something like that? You mean...
I mean, I think one, it depends on what your reaction is, right?
Okay.
And the propensity. Normally, well, because for instance, for food, right? What's
Yep.
the issue with food? People can react with food and no one can know you're allergic and how to treat you. More often than not, I say you can put it somewhere in like your pocket, a wallet card. Europe actually is notorious for people having wallet cards with their medication allergies listed.
Oh,
It hasn't caught on in the US as much.
that's actually super
But I think it's super useful,
smart. Yeah.
for heaven forbid, for like if a car accident happens
Yeah.
and they want to treat you with something that's more common,
Yeah.
then it may be worth knowing, right? Depending on what you're
Of
allergic
course.
to.
Yeah.
But I would say it depends, right? I have a hard enough time convincing people to get like alert bracelets for food. So
Let's say you do your workup and you find out, we talked so much about penicillin. They're penicillin allergic.
Right.
Do you kind of put your foot down? You need a bracelet.
I say if you don't want a bracelet, put it in your phone, put it in your wallet, some
Okay.
kind of. And then sometimes I tell people if you don't want to specifically list it, you can just put like allergic.
Okay.
Right? So if you don't want the whole world to know,
Okay.
you can just put it, and usually they'll check the wallet, they'll check something that has allergies listed. Luckily, we don't get drugs like more often than not, like hidden or like so. No one's going to secretly give you an ibuprofen if you're alert and oriented without you knowing, right? Like it's not like it's something like a food that can be hidden and it could be mistaken.
So, since we're getting to the end, within allergy and immunology, how did you find passion for drug reaction and drug allergies? It shows it right now with your answers and your fun facts. You could have gone into a lot of different things.
I probably could have, right?
Yeah.
When I was a fellow, it was like my first weekend on call as a fellow, and we had a patient who had a reaction to chemo, right? And they sent the patient, and they were right. The whole point of giving a medication is that there's no alternatives. The Brigham, i.e. Harvard, published that specifically for chemo, and this came years after I was a fellow, but that using second-line agents is not as good for the patient long-term data.
Sure.
So I was a fellow, and this patient was allergic to his chemo. And they came to me and they were like, you need to find a way to give him this medicine, right? This is like my second week in the hospital, right? And I was like, oh my goodness, what do I do?
Yeah.
So I started looking in the literature and I found all these publications of desensitization, right? So then we got him his medicine, we desensitized him, he tolerated it. And that's how it started.
That's a great story.
Oh,
You know what I
thank
mean?
you,
And I
thank
like
you.
that, So with that being said, this is going to be our last question together. I'm already tearing up a little bit. So, which is, if anyone, whether it be a healthcare professional or the general public, wants to learn more about drug allergies, or even you, because they find you kind of interesting, what is the best way to contact you in general?
I'm definitely on, I would say, the Keck website. So you can easily send me an email. But my Keck email is asal.naderi@med.usc.edu. If that's way too hard to remember, you can just literally find me on LinkedIn. I'm on there too. Send me a message. I love drug allergy. My whole goal is to educate. We have national websites too if you just want to learn more about allergy. It's AAAI. You can literally type it into Google and the websites on allergies will come up, and they actually have information for like healthcare providers, the lay public, if you just want to learn a little bit more or interested.
And I will say this, because you're right in front of me. Everyone, I wish I could just film this. She is so passionate about this. Her fun facts, she really, truly enjoys giving them.
I think it is fun.
And I'm going to tell you, your patients are lucky to have you.
Oh, you're so sweet.
And I'm lucky to have you being teamed in our books. So we're going to do this again. Does that sound okay?
Absolutely.
You know what? We could be a fun one between us. I'm just kind of pulling this out of nowhere. Asthma.
Oh, asthma's super fun.
Let's do one together.
Yes, and we have a lot of fun. And you know this, we have a lot of more fun treatments for asthma than we've
That's
ever
what
had
I'm
before.
saying. It would be kind of interesting, my perspective, being a lung doctor, and your perspective. Because we should team up more instead of is that what the allergist did? Is that what the pulmonologist did?
Yes.
Let's
Yes,
do one
let's
together.
do it.
All
Let's
right,
do it.
cool. So everyone, I hope you enjoyed today's Dr. Raj podcast. You know what? She did such a great job. I might even put her on my Beyond the Pearls podcast so we could have her tips help out our medical professionals and medical students. And remember, if you think you have a drug allergy, stop that drug, seek help, and stay tuned for more episodes of the Dr. Raj podcast.
Thanks for listening. This has been a production of Ars Longa Media. Our producers are Madison Linden and Chris Brightigan. Our executive producer is Dr. Patrick Beeman. This podcast is for educational purposes only and not intended for medical advice. Ars Longa, Vita Brevis.
The holidays mean more travel, more shopping, more time online, and more personal info in more places that could expose you more to identity theft. But LifeLock monitors millions of data points per second. If your identity is stolen, our US-based restoration specialists will fix it, guaranteed, or your money back. Don't face drained accounts, fraudulent loans, or financial losses alone. Get more holiday fun and less holiday worry with LifeLock. Save up to 40% your first year. Visit LifeLock.com/podcast. Terms apply.